Hello, Dr. Lance Hardison. Going to talk about Achilles tendonitis today, along with a posterior calcaneal spur, or a heel spur on the back of the heel, which is different than plantar fasciitis or a plantar heel spur. These posterior meaning the back of the heel. So the posterior heel spurs can be very painful, and they're generally accompanied by Achilles tendonitis as being the inciting event. Achilles tendonitis is inflammation of the Achilles tendon, and it can be where it inserts on the heel, or it can be up in the area just above the heel where most of the Achilles tendon ruptures occur. That being said, the tendonitis occurs initially from some inciting event, such as increased activities that you're not used to. So starting to work out, you do too much too soon. A twisting or some type of traumatic event that inflames the tendon itself, causing a inflammation of the tendon. And then over time, the spur can form as the body's trying to heal this injury on the back of the heel bone. So once the body starts to heal this initial injury, the body lays down fibrous tissue, calcium deposits, bone, trying to heal it, but it forms this big spur you see on X-ray and on MRI and any other modality that you might get for the patient. Things you can do to try to alleviate the pain: you can stretch. Obviously, stretching will lengthen the muscle itself, in essence lengthening the tendon, so you don't have so much pull on the tendon. With women, high heels do seem to take some pressure off as the pressure is alleviated when your heel is up, so it shortens the calf muscle and takes pressure off of the tendon itself. Then when you get home and you take your heels off, you have to get your foot back down to normal so you can walk normal. You don't walk on your toes, you walk normal. So when it pulls back down, that tendon and the muscle has to stretch back out so it's tight again, and you get the response all over again. So with that, the heels can cause problems. So you can get into a shoe or a backless shoe, I guess you could say, which is a completely different video, because those are horrible for you. But in certain times like these, you might need those. This takes pressure off of the back of the heel, doesn't rub, and doesn't cause the pain. You can use really any type of shoe that takes pressure off the back of the heel is going to help you. Decreasing activities. So if you do tend to go to the gym, work out, I don't recommend you working out with high impact activities such as running. Even leg day needs to be skipped. Like leg presses, you can probably do some leg extensions, no calf raises, that kind of thing. But I would just skip the day altogether and let it heal. It needs to heal about 4 to 6 weeks. So that'll give it some time to rest. When you're doing this, I recommend wearing a walking boot. The walking boot will help immobilize the foot and ankle and decrease the motion of the Achilles tendon itself. When you're walking without the boot, you're pulling up every step you take on the Achilles tendon, so it pulls your entire body weight up. With the boot, it's one big motion, so you're not moving at the ankle joint, so it lets the Achilles tendon rest as it needs to rest. That's about 4 weeks. I will generally see my patients back at that time, see how they're doing, have them go on their toes, push around in the area. If there's still pain, it's not quite ready, maybe even get an MRI to rule out some small tears within the tendon. The spur is also generally intratendinous or partially intratendinous, meaning that as it comes off the back of the heel like this on the X-ray, the tendon is also coming up like this. So that bone, at least surgically, you can see that it is partially intratendinous, or a lot of times it is 100% inside the tendon as it comes down and inserts on the heel. So with the spur itself, it's very difficult to deal with, because that becomes the main problem of the entire pain, is the spur rubbing on the heel of the shoe or whatever you're wearing, boot, whatever it is that you might be wearing. And then that in and of itself can start the tendinitis over again. So it's a vicious circle from the spur to the tendinitis. You rest the tendinitis, you get back to doing what you're doing, and the spur can irritate the tendon again, going back to tendinitis. So it can heal on its own. I'm sure the spur has generally been there for many, many years. It just wasn't a problem until some inciting event causes the Achilles tendonitis, and then off it goes. So after an extended period of time for conservative therapy, you can do physical therapy. I don't recommend injections in this area, as if it's a steroid injection, it can cause a rupture in the tendon itself. Then you're in a whole new ballgame again. So I don't recommend injections here. I recommend a Medrol dose pack or NSAIDs or both at different times, of course. Resting, icing, compressing with either ACE wrap or compression socks. They have good compression running socks that are really good. And then, of course, the boot is the mainstay of conservative treatment, the walking boot. If this fails, maybe some PT can help decrease the Achilles tendonitis down to nothing. So you can do dry needling, you can do ASTEM, you can do certain exercises, iontophoresis, phonophoresis, which are just ultrasound modalities that you can put transdermal anti-inflammatories in that area to help with inflammation. If that fails as well, then you're at a point where surgery might be entertained. Now, surgery consists of what's called a detach reattach, which I have a video up on my YouTube channel, which is Your Foot and Ankle Doc, Your Foot and Ankle Doc, all lowercase, all one word. There's no spaces. The video is on there, so you can see how that is done and how I repair that for my patients. And the course and everything, the post-op course and all that is on the video as well at the end. So that's a kind of a brief overview of what Achilles tendonitis is and the heel spur, what it is, the causes, the conservative treatments, and then of course surgery. Again, Dr. Lance Hardison, Your Foot and Ankle Doc, all lowercase, no spaces, all one word, one long word. That's on YouTube, and then I'm also on Instagram and Facebook, as well as Twitter. So follow me, subscribe. I would love to hear comments, suggestions, and I will talk about whatever topic you want me to if you have recommendations. I'm here for you guys, and have a great night. Bye-bye.